How to live with ADHD. A child sitting in a classroom at his desk hears the teacher speaking, sees a child drop a pencil, sees a child turn a page, hears two students whispering to each other, hears a book drop, someone sneezes, another child raises their hand. All are common things in a classroom, but to a child with attention deficit disorder, or ADHD, every one of these stimuli is intensified to the point that they cannot concentrate on just one thing. In this case, the teacher speaking. The typical ADHD student cannot block out all the other activity in order to concentrate. Hi, my name is Jessica Zimmerman and my son has ADHD. The purpose of this speech is to better inform you of what ADHD is, how to treat it, and how to cope with it. To begin, let's talk about what ADHD is. According to educator Carl Swanson's Students with ADHD journal entry on November 12, 2007, Attention Deficit Hyperactivity Disorder, ADHD, sometimes called ADD, Attention Deficit Disorder, when not accompanied by hyperactivity, is not easily diagnosed. There is no specific test, such as a blood test, to diagnose it. There are certain symptoms that must be present, but they can vary with each individual. In the year 2000, the book What Every Parent Wants to Know by David L. Woodridge, PhD, tells the symptoms for a positive diagnosis for ADHD. They must contain the following 4 conditions: presence of a minimum number of symptoms, 6 or more of either inattention or hyperactivity, impulsivity, or both, presence of symptoms for 6 months or longer, presence of symptoms before 7 years of age, impaired functioning in 2 or more settings caused by ADHD symptoms. Symptoms of inattention include fails to give close attention to detail, careless mistakes, difficulty sustaining attention, does not seem to listen, does not follow through on instructions, has difficulty organizing tasks, avoids tasks that require mental effort, such as homework, loses things necessary for tasks like pencils, books, etc., easily distracted, often forgetful. Hyperactivity often includes fidgeting with hands, feet, or squirming in seat, leaves seat when not supposed to, runs about or climbs excessively when inappropriate, difficulty playing quietly, often on the go or driven by a motor, often talks excessively, blurts out answers before questions are asked, has difficulty waiting their turn, often interrupts or intrudes on others. Now that we know what ADHD is, let's look at what the treatments are. ADHD can be treated with medicine, diet, and coping mechanisms once there is a diagnosis. Medicine has the most dramatic effect on very hyper ADHD patients. It is fast acting and can be highly effective. There are very strong views on using or not using medication because it is a mood altering stimulant that is most often used. Stated by Sandra F. Reeve, MA, the book The ADD ADHD Checklist, stimulants have been proving to work for 70 to 95% of children with ADHD. The results can be dramatic. Stimulants in the bloodstream work to activate the areas that are not working effectively. They are the regions responsible for attention, inhibition of behavior, regulation of activity level, and executive functions. There are many side effects with medication. The most common are loss of appetite, headache, stomach ache, mild sleep disruptions, irritability, moodiness, agitation, and tics. Most side effects are mild. A doctor will closely monitor side effects and adjust dosages as needed. Since stimulants have so many side effects and are mood altering, many parents are afraid to let their child use them. There is some success with diet and behavior management. None of these treatments cure ADHD, but many will help manage it. Although there is no cure, let's talk about some ways to cope with ADHD. People with ADHD learn different coping mechanisms over time. As teenagers or adults, they learn what things work best to keep them organized and engaged in what they need to accomplish. Some coping mechanisms are exercising, which helps burn off some of the excess energy. In the Conscious Parent's Guide to ADHD 2016 by Rebecca Brandstetter, PhD, the book claims exercising also increases your child's brain levels of dopamine, norepinephrine, and serotonin, 3 neurotransmitters that improve focus and attention and also enhance feeling of well-being. Organization is also hard for an ADHD person, but as you get older, you learn to set your own systems so you can stay organized and on track. Diet can also be a factor in controlling ADHD. Some teenagers and adults find that they can cut back on medication and use coffee or caffeine to stay focused instead. A healthy diet can help by keeping you focused. A new coping mechanism is a fidget spinner. It can allow hands to stay busy while focusing on a task. Having a routine is very helpful because it lets a person with ADHD know what is coming up next so that the transition to a new activity is easier. In conclusion, ADHD is a very complex disorder with many treatments and coping mechanisms. It is never cured, it doesn't go away, but it can be well managed. With the proper medication and coping skills, people with ADHD can become very successful.